Another question when it comes to vaccine distribution, where do children fall into getting these shots? Well, we are learning they'll likely be last because their risk of serious cases is so much lower. Alan Janae looking into this for us tonight, and Alan, vaccine trials for children are now starting.
Well, these vaccine trials are now getting going not because actually the vaccine makers were concerned about giving them to children, but because they wanted to test them on people more seriously affected by COVID first. There is already a substantial amount of misinformation out there about the vaccines, misinformation that top pediatricians say they're likely to have to push back on. It's going to be a while before we'll cringe at the cries of children getting a shot for the coronavirus.
Children are not going to be in the first or even the second wave of giving the vaccine.
Castle Rock pediatrician Dr. Michael Malofsky says he's already hearing misinformation back from parents.
That false idea that this vaccine development was somehow rushed in a way where corners were cut or proper procedure wasn't done in order to get this vaccine to market, and that is not the case.
Children's Hospital's Dr. Sean O'Leary leads a discussion with pediatricians every couple of weeks.
Do vaccines work in any way different with children?
It depends on the vaccine. In some cases, actually, vaccines, you get a more robust immune response in children than you do in adults, and they're actually more effective.
He's not yet seen trouble.
We're not seeing any serious safety concerns. We're seeing local reactions and some systemic reactions like fever and fatigue and things like that.
The research the vaccines are built on has been going on for decades.
In some ways, they're working in a much more elegant fashion. For example, some of the vaccines that we still use even are using quite old technology.
By the time children are vaccinated, says Dr. Malofsky, millions of doses will have been given.
We're going to have way more information about it before it gets to the wider public anyway. So I think that will only boost the confidence.
There are already vaccines for diseases that go easier on children, points out Dr. Malofsky, like rubella. Now, rubella doesn't hit children hard, but if a child gives it to a pregnant mother, that mother's baby could have lifelong problems. And COVID may hit older people seriously, says Dr. O'Leary, but it does hit children hard too. They care for them every day here at Children's Hospital. In Aurora, I'm Alan Janae, covering Colorado First.